Hi, my name is Karen Logan. I'm with Department of Human Services. I'm the Child Welfare Intake Manager, and I'm here to talk to you about the responsibilities of first responders in our community. This is a three-part series that is going to discuss how law enforcement, how our medical professionals, as well as Department of Human Services can work together for the safety of children in our community. In this series, you may either see the full series together or a three-part series with different professionals to talk to you about what their roles are in child abuse and neglect in our community. So again, my name is Karen Logan, and I'm going to cover child abuse and neglect, what it is, how to define it, and what you can do to report it. So as far as the definitions go, the Children's Code defines child abuse and neglect for us. It is the legal definition of what child abuse and neglect is. Physical abuse is the easiest definition for us to define for child abuse because it's a physical sign of abuse or neglect to a child. So it's bruising, it's bleeding, it's any type of injury that is visible to the child that you can see. When we talk about illegal substances or legal substances, that's an issue for our community. Obviously, we've had some rule changes in our community about what is legal and what is not legal, and it does impact children's ability to be safe as well as a parent's ability to protect their children. So in the Children's Code, it says that any case in which on the premise of where a child is residing, a controlled substance is defined in Section 1818-102 CRS is manufactured or attempted to be manufactured. This area is really to define on the illegal substances that are being manufactured, such as methamphetamines or other types of illegal substances that children may have a residual effect from through the manufacturing of. When it comes to marijuana, although now we know that marijuana is legal in our community, we want to make sure that parents are keeping their marijuana plants, their marijuana products, and things like that locked up so that children cannot have access to it. So again, even though it may be legal, if a parent is not keeping their children safe or protected from these items in their home, then that is considered child abuse and neglect. What we want to talk about as far as illegal substances and even legal substances, because there's lots of legal substances that parents take, such as Ambien or Percocet or Vicodin or those kinds of things that a doctor may prescribe to them. If it is impacting their ability to parent their child, their capacity to keep those children safe, it could be considered abuse and neglect, even though they may lawfully be taking that substance. So when we talk about parental capacity, are they willing and able to keep their children safe? And so those are the things that we need to look at as a department and as a community when we talk about substance as a whole. When we have children that test positive for illegal substances or even legal substances, again, we have to look at not only what the definition says, but whether or not that was a required issue for that parent to take during their pregnancy or so on. So if we have a baby that's at the hospital who tests positive for marijuana, but the doctor actually prescribed marijuana for that parent during their pregnancy, it's not considered child abuse and neglect, and we would not find on that parent. But if they're taking it and they become pregnant and the doctor indicates that they should stop taking it and they still do anyways and that child is positive for that substance, it can be considered illegal. And we would consider that to be a founded allegation of child abuse and neglect. For neglect, neglect is any case in which a child in need of services because the child's parents, legal guardian, or custodian fails to provide adequate food, clothing, shelter, medical care, or supervision that a prudent parent would take. Now this is kind of a loose definition, and we have to remember that poverty is not child abuse, but an unsafe environment is. So when we talk about whether or not a child is being neglected, and we're talking about the areas of education, their environment, their adequate food and clothing, we are talking about whether or not children are safe in that particular capacity. So a parent who may live in the shelter can still be determined to be safe because that parent is doing all that they can to make sure that that child has a roof over their head, warm clothing, or a place to be that's safe for them to live at. When we talk about unsafe environment, we have to look at the environment in direct correlation to the child's capacity and functioning level. So if you have a very small child, the condition of the home is very different for a 2-year-old than it is for a 12-year-old because 12-year-olds are much more able to self-protect. I may tell a 12-year-old, help mom clean the house, but a 2-year-old is going to pick things up off the floor and may put them in their mouth and things like that. So the condition of that home is directly related to the age of that child. And you should make certain that if you come into a concern for a condition of the home where it is impacting the safety or health of a child, that you call the department, because we can go out and assist the family in getting that home to the condition that it needs to be so that kids can be safe, as well as work with the family to prevent it from getting in that condition as well. Emotional abuse and neglect. This is a gray area for us as well, because again, it's not one of those things that kids wear on their chest that says I'm being emotionally abused or neglected. But some key points that I want to make sure that you understand about emotional abuse and neglect is that it is identifiable and substantial impairment of the child's intellectual or psychological functioning or development, or substantial risk of impairment of the child's intellectual or psychological functioning or development. So we're talking about rejecting behaviors. We're talking about terrorizing behaviors, ignoring, corrupting, verbally assaulting, and domestic violence. Domestic violence is one of the biggest underreported allegations in our community when it comes to our children, because the indication that the violence is between the parents and the children are not impacted is not necessarily correct. We have a large number of children that when we interview them and we talk to them about the violence that's going on in their home say, yes, I heard them screaming, I lock my door, I go under my bed, I hide in my closet, I'm scared, I don't know what to do. So although they're not physically indicated or hurt in that altercation between the grown-ups, they are impacted, and that is considered emotional abuse and neglect. So again, those are things that need to be reported so that we can look and reach out to the family, reach out to the adult victim to help them with services, as well as help make things safe for the children also. Sexual abuse, any case in which a child is subject to sexual assault, molestation, sexual exploitation, or prostitution. Unlawful sexual behavior with a child is not only not good for children, it's oftentimes illegal. So all incest cases require joint investigation with our local law enforcement agency, whichever one falls in that jurisdiction, and the Department of Human Services. And there can be felony charges involved in that. So it's important that you report that either to the department or to law enforcement, and we make certain that we contact our local law enforcement or they contact us so that we can do the intervention that's necessary for those kids. The only exception to this is children under the age of 10 years old. When there is a child who is sexually acting out against other children and they're under the age of 10, the department still does an investigation, but it's an outreach to the family to let them know this is unlawful behavior for a child. What is healthy sexuality for a child? What's normal sexual acting out behavior? Those types of things. And we want to offer services to the family to help with what's going on with that child as well. Protective parental capacity is paramount when we talk about sexual abuse investigations. In all investigations, we're looking for the protective capacity of a parent, but sexual abuse specifically, because that parent has to not only be willing to protect their child, but also able to protect their child. So that means, one, that they believe that the child has been injured through this behavior, and two, that they are going to take action to make sure that that child is safe. So willing and able is very important, especially when we're talking about sexual abuse. Some of the key concepts that the department looks at is safety versus risk. Safety is the avoidance of current harm, danger, or injury. It's what's going on right now. It is what is impacting the child right this very minute, or in the very near future at least. Whereas risk is the likelihood that there could be harm, danger, or injury in the future. Both are concerning for children, but imminent danger and current safety issues are something that we need to take action on pretty quickly for the safety of kids. Protective parental capacity, able and willing to keep the child safe. And then we also talk about not justifiably explained. What that means is that the injury is either inconsistent or suspicious with the history of events. And it could be a physical injury, it could be emotional issues that are going on, but it just doesn't meet the right definition, or it doesn't make sense based on the information that we're receiving. And it's a non-accidental occurrence. So if we receive information from a parent that says, well, my 1-month-old baby rolled off the couch. Well, we know 1-month-old babies don't roll, so that's a concern. And we want to make sure that they understand that that's not consistent with the injury. There's got to be another explanation for what's going on. And our job is to rule out that that other explanation is not abuse or neglect. Mandated reporting. Lots of mandated reporters in our community. We are one of the largest counties in the state, and we have a large number of school districts. They are mandated reporters. Hospital staff are mandated reporters. Therapists, people that work with vulnerable populations are considered mandated reporters, as well as all law enforcement and first responders are mandated reporters. What it says is that you have a suspicion, you don't have to know, you just have to suspect that abuse or neglect has or may occur, and you work in an environment which children or vulnerable adults. Concerns have to be reported immediately to DHS or to law enforcement. If you fail to report, you could be charged with a Class 3 misdemeanor, which could result in 3 months in jail or a fine. So the piece of this that's really important is less about the punitive damage of not reporting, but what the impact is on kids. You should be reporting because you care about children in your community, and these children are not able to protect themselves. So it's going to be important that you make sure that they're being protected and that parents are getting the help that they need so that kids don't have future harm. DHS reports to law enforcement and law enforcement reports to DHS. So even though you may make a report to DHS, we in turn then have to share our information with our local law enforcement agencies. This does include our military bases because we have a large military presence in our community. So we stay in close contact with our CID staff, our MPs, all of our law enforcement agencies, and all of the different jurisdictions in El Paso County. So we want to make sure that that stays open, that we're able to share information, and we are able to freely share information regarding our history as well as law enforcement's history in the investigation of child abuse and neglect, because the Children's Code says that we can, and that gives us the authority to do that. So if you want to make a report regarding child abuse and neglect, there's lots of ways in El Paso County that you can do this. You can call the Department of Human Services. The number is 719-444-5700. This number is manned 24 hours a day, 7 days a week by staff, both inside the department, and after hours is manned by supervisors and caseworkers that have experience to be able to handle questions and respond to child abuse and neglect. So again, this is a 24 hours a day, 7 days a week number, which is also available to first responders if they need additional information regarding the family, if they need to know what the department's history is with this family, or how to locate other family members or things like that. This number is available to first responders to be able to answer some of those questions. We also have an email address, which is the DHS Child Abuse Report at elpasoco.com. That email is monitored. However, I would not recommend that you send an email to this address if you need an immediate response. An immediate response should go to the number that's already listed and that I've provided to you. But this email address, if you want to send information, it's a little bit more lengthy than the time you have to spend on the phone with a worker, send it to this email address and we'll get you back with information on what the reporting number is and who you can contact if you have questions. For other Colorado counties, if you need to report, you can also go to this www.colorado.gov/CDHS. That has access to all of the different counties and what their contact numbers are, or you can contact them and they will forward their information on to the direct county that you need to. Check listings for all local law enforcement agencies if you're not sure which jurisdiction it falls in. Our law enforcement is very receptive in our community. If it doesn't fall in their jurisdiction, they'll let you know that and let you know what the right number is to call. Okay, if you have any questions, please feel free to direct them to the email that is listed here or to call this number. We'd be more than happy to answer any questions that you might have. Thank you.